If you have dry eye, you know how uncomfortable it can be and how frustrating the treatments can be. You either feel like you're using artificial tears all day long, or you're using prescription eye drops that can be extremely expensive. Sometimes it feels like it takes up so much of your time. But there are 4 out-of-the-box ways that you could possibly change your environment to help to improve your symptoms. So let's get into it. I'm going to start with the one that I think may be the most important and is probably off of most people's radar. What most people may not realize is that so many medications have dry eye as a possible side effect. Medications that may have dry eye as a side effect include. So that puts us at the first unconventional method for improving your dry eye symptoms, and that would be to evaluate with your primary care physician or other providers what medications that you're on, if dry eye is a side effect, and if there's some lifestyle change that you can make that may eventually help you to discontinue that medication in the future. Now, I am not telling you to stop taking your medication, and I'm not telling you to tell your provider that you need to stop taking your medication. What I am suggesting is that you evaluate what medications are there and see if there's anything that you can do that could eventually lead to you no longer needing that medication to keep you healthy. Major shifts in lifestyle can be difficult to implement, and it may take years to see the benefits that could eventually lead to the ability to discontinue a medication. But it may be worth it, especially if you suffer from very severe dry eye, or if you're looking to get healthier in general. There's actually a new documentary on Netflix called Live to 100: Secrets of the Blue Zones. And this is about people who live long and very healthily long lives, who live in much different ways than the typical person does. And this really inspired me to think what we can do to change our overall underlying health, and that could help to improve a lot of things for a lot of people. I'm definitely not an expert on nutrition, but it's definitely something worth watching and considering. The cost of this out-of-the-box method would mainly be the cost of seeing those providers to see if these are possibilities and monitoring that over time. But if you look at the flip side, you could end up saving yourself a lot of money in healthcare, a lot of time spent in the healthcare system, and possibly surgeries and treatments and medications that are very expensive in the long run, and just an improvement of your overall health. Another out-of-the-box way to manage your dry eye symptoms could be with moisture chamber glasses or goggles. And these are the glasses that I actually use. So I have really bad dry eye, and I live in the desert. I find it difficult to put in artificial tears throughout the day. I also find the prescription medications to be very expensive, and I would always rather change or adjust my environment in even a little way to improve my symptoms versus use a medication day after day. That's my personal experience. If you align with that, this may be a really good option for you. And if you're worried about the cosmesis of it all, I have another option coming up next that you might like a little bit better. Now, I don't wear these all the time, but I find that they can be very helpful in particular situations, like going on long walks, especially on a windy day, cutting onions, because I don't think I would be able to even cook without them, and wearing them when I'm going to be reading for a long time, especially if I have the air conditioning on or I need to have the fan on. They can help here and there, or some people may want to wear them all the time, but I find them extremely comfortable and helpful. And the reason they work is because they help to hold in moisture. The back of these glasses are lined with a foam. Some have silicone, and it basically just creates this chamber of moisture around your eye, and it blocks off any air coming from HVAC systems, pollutants that might be in the air, smoke, anything that could cause irritation to the eyes. I'll put a link in the description below for a website that has a lot of different options available for frames like this. I'm not being sponsored by them. I just really, really like my glasses. Mine are a Wiley X, so you can find them there. But there are those different options that I mentioned, whether foam or silicone, and it's worth checking out. It's even better if you can go to an optical and if they have something like this there, because trying them on is going to be really important. You want to be sure that there's a very tight seal around the eyes, and it may be difficult for some people to find frames that fit them perfectly, especially if you're very petite. The great thing about these is that there are frames available that you can put your prescription lenses into. So you may want to talk to your optical about whether those options are available. If you're looking to get some that fit over your glasses already or you don't need a prescription, there are options on that website for $25. So the cost of these could really range from $25 to maybe even up to $800 if you get prescription lenses put in there. And there may be coverage by vision insurance, so that's something to consider. To put that into perspective, there are prescription eye drops out there that treat dry eye that can be around $550 a month, sometimes even with insurance. And that total could range from $6,600 to up to $7,800 a year. So I think the glasses could be worth it. Aside from symptom relief, there are benefits to this method. If you have a stable prescription, or if you get a pair of goggles that doesn't have a prescription, you could use these glasses for many years if you take care of them well. And a lot of them have the option to change out the foam backing if it gets old or worn down. And that would be an inexpensive switch compared to spending lots of money on other medications or artificial tears and having to put those in constantly. Dry eye is uncomfortable mostly because the cornea is so sensitive. And when the tears dry out, that leaves the cornea exposed, leading to irritation, pain, blurry vision, foreign body sensation, among many other things. So that brings us to our third option, which would be a scleral lens. This is kind of like the moisture chamber goggles, but pushed right up against the eye. A scleral lens is a rigid contact lens that's larger than a typical soft lens you would see. It's filled with a preservative-free saline, and the lens is then placed on the eye, and it actually doesn't move around like soft contacts do. It stays in place with that preservative-free saline inside. So it keeps the eye bathed in saline all day. So it's kind of like a little moisture chamber right there on the eye. And that's how they work to relieve symptoms, and they can be used to treat dry eye. Scleral lenses may not be the best option for everyone, especially, for example, people who have lid wiper epitheliopathy. And that refers to when there's trauma to the lid wiper, which is the epithelial cells that line this certain part of the inside of your eyelid, which help to spread the tears across the eye. So if that area is damaged, rubbing against a contact can be uncomfortable and may not work the very best. Also, contact lens wear is something that is thought to lead to lid wiper epitheliopathy, so it's, of course, always best to check with your doctor what options may be best, but discussing scleral lenses may be worth it. You might equate wearing contact lenses with exacerbating dry eye, but with that, we're typically talking about those soft contact lenses, whereas these can actually be used to treat dry eye. The cost of scleral lenses is a little bit difficult to estimate because it really depends on the provider who you see. Sometimes scleral lenses cost $500 each, and the fitting or all the appointments with the doctor to fit the contact lenses properly could range from $500 to many thousands of dollars. It really depends. And there's also other little costs like getting preservative-free saline solution to fill the lenses every day, and the conditioning solution and cleaning solution that you use to soak the lenses at night. So the total overall cost could range from around $2,000 to $3,000. Though since dry eye is considered a medical condition, sometimes medical insurance does cover the fit of these contact lenses for dry eye, so it's definitely worth finding out. Another thing to keep in mind is that not every doctor fits scleral lenses, so talk to your doctor about your options there, or maybe there's someone that they can refer you for your scleral lens fit if this is something that you're interested in looking into. Aside from symptom relief and possibly needing less of other medications that you might otherwise need, the benefit of scleral lenses is that you may not just improve your dry eye symptoms, but you may also be able to simultaneously correct your vision. Because just like any other contacts, you can correct your vision in these contact lenses. So that's a pretty cool little bonus. Get a humidifier. If you already live in a humid environment, you are one step ahead, but if not, you can work on changing your environment to be a little bit more comfortable all around. We can't all just up and move, but a humidifier can make a really big difference just by adding more moisture to the air. There are many different types of humidifiers and different sizes. I opted to get one that's supposed to be a whole house humidifier, and I thought about bringing it to show you, but it's huge, and if it was on my lap, it would cover my face. But it has been very helpful to me. This method works because humid environments are always going to be better for dry eye symptoms. So if you can improve or change the humidity in your environment, you could improve your symptoms. The cost of this method really would depend on the type of humidifier you get, and you have to keep in mind changing out filters every 1 to 3 months and getting bacteriostatic solution to make sure you're not filling your air with microbes or mold. But in general, at around $200 for the first year and not very much for any subsequent year, it's much less than most of the dry eye treatments that are out there. And that's another great thing about it, is that you can use it for years. And aside from the benefits to dry eye, it may help to improve allergy symptoms as well, and it might also help other people in your household. I do have one final bonus tip for you. Move. We can't all just up and move to a humid environment, but you could at least take a vacation to somewhere humid, and then maybe you'll want to move. Have you tried any of these unconventional methods to manage your dry eye? How did they work for you? Let me know in the comments. Thanks for watching, and I hope to see you next time.